The 2017 Ortho Award is quite an honor. I think the opportunity to be recognized by the Canadian Society for the work that my team and I have done in Edmonton over the last 15 years or so in the area of transfusion medicine, I think is really quite amazing and quite humbling to think that we are now recognized at a national level. The work that we do in understanding what's in the bag, I think, is partly what's influenced the CSTM organization to recognize the work that we've done. We've really emphasized the area of understanding the product quality and product safety profile of the products that we produce at Canadian Blood Services, and linking that in a very interdisciplinary way to try to understand the donor factors, the work that we do at CBS in terms of manufacturing, the storage of those products, and then working with groups across Canada and across the world, trying to understand what that really means for different patient groups. The work that we do at Edmonton really focuses on product quality from a variety of different lenses. We look at it from a variety of different ways, really understanding, again, what it means to us from a policy and procedures perspective at CBS, what we can do to screen donors better, to make the product safer, what we can do on the manufacturing side and storing those products. But ultimately, we need to understand what that means to the patient. And we do a lot of work within the Canadian Blood Services with our quality control and quality assurance programs to meet regulatory standards. But sometimes we neglect to obviously consider what that means for the patients, or we have the inability to understand what that means to the patients. So the work that we do in Edmonton, as well as with other aspects of our transfusion medicine research program at CBS, really try to bridge that. We try to look together at the whole continuum, the vein-to-vein continuum. Yeah, I think one of the keys to my success early on was the recognition that I don't know everything. No, you can't know everything about blood and blood safety and blood quality, that you really need to work with others. You need to really collaborate and develop those collaborations with those areas that you want to work in, but you may not have the expertise in. So I was very fortunate to make connections with a variety of Canadian researchers and international researchers who were doing the kind of work that I was interested in getting involved in, and then bringing to that collaboration the access to the kinds of data that we generate about what's in the bag, understanding the components of blood manufacturing, for example, and bringing that collectively together with those other researchers to actually have the impact that we've been able to have. The other area is really understand what it is you want to achieve. I think the challenge we have in research is we're always competing for grants. We're always trying to fund the programs, but ultimately that has to be done with a real understanding of where you want to take that. And I learned early on in my academic research career that discovery research was where I was really passionate about, being able to solve real-world problems in the transfusion service, or with the blood manufacturer, or even with the the hospital transfusion service, using my expertise, my knowledge, my experience to help solve those problems that they're having on a day-to-day basis. And I found that very rewarding because we're able to solve these problems and then also see the impact. So being able to see that impact on a month-to-month, a project-to-project, a year-to-year basis really has kept my team motivated and really engaged in the kind of work that we're doing. So for those early stage researchers, there's obviously the desire to do excellent research, excellent scientific work, but having that link to the outcomes that you're trying to achieve really helps bring the message home in terms of why you want to be doing this. So I think finding collaborators that can help you do that and finding that passion, I think, are really important.